Hey everyone, it's Sarah, the registered nurse, RN.com, and in this video, I'm going to talk about how to become an LPN. First, LPN stands for Licensed Practical Nurse, and in some areas, LPNs are referred to as LVNs, which stands for Licensed Vocational Nurse. And throughout my time as a nurse, I have worked with some amazing LPNs. So how long does it take to become one? Well, if you're interested in becoming a nurse, one of the fastest ways you can actually do this is to become an LPN. And to become an LPN, you need to attend an approved LPN program that is typically offered by a technical school, a community college, or by some universities. And LPN programs vary in length, but most tend to be about 1 to 2 years within the U.S., with most programs being about 12 to 18 months. Now, before attending an LPN program, you have to meet some admission requirements that are set by that program. And these requirements can vary depending on the school. But some common admission requirements include the following: submitting an application to the program, taking an entrance exam such as the ATI-TEAS exam, passing a drug test and/or background check, meeting health requirements such as vaccination records and a physical exam, obtaining CPR certification, and having health insurance or personal liability insurance. Furthermore, some programs may require that you take a few general education courses prior to admission, such as algebra, medical terminology, and so forth. But again, that will depend on the program's specific admission requirements. Now, once you enroll and complete the educational requirements set by that LPN program, you will be awarded a diploma or certificate. But there's one more step that you have to take before you can practice as a licensed practical nurse. You have to pass a state licensing exam for the practical nurse, known as the NCLEX-PN exam. And once you pass this exam, you will be able to work as an LPN in your state. So what are the job duties of an LPN? What do they do on the job? Well, LPNs play a vital role with working with other members of the healthcare team to provide direct and indirect patient care. And some of their duties include collecting vital signs of patients, medication administration, assisting with patient hygiene, monitoring the patient's health status, and collecting patient admission information. However, the scope of practice for LPNs can vary a lot from state to state, and some states may allow for a wider scope of practice for the LPN. Now, how much money does an LPN earn per year on average? Well, according to the Bureau of Labor Statistics, in 2020, the average salary for LPNs/LVNs in the United States was $50,090 per year, or $24.08 per hour for all the states combined. So some LPNs may earn more or some may earn less, depending on their location, experience, certification, industry, and so on. They project that this profession is to grow by 9% between the years of 2020 to 2030. So where do most LPNs work? They tend to work in nursing care facilities, offices of physicians, home health care services, general medical and surgical hospitals, and continuing care retirement communities. And the great thing about working and becoming an LPN is that there's always opportunities for career advancement. So one of the great things about the nursing profession is that it offers a wide variety of nursing specialties that you can work in. So if you're an LPN and you find that, this facility isn't really working for you with a specialty, you can move on, find another specialty that focuses on a different patient population. In addition, you can obtain certifications, which can help widen your scope as an LPN and potentially help earn you a higher income. And then finally, as an LPN, you could always go back to school to become a different type of nurse, such as an RN. Many universities today offer an LPN to RN program, and if you decide to advance even further, you could always attend a master's degree program to become an advanced practice registered nurse, such as a nurse practitioner, CRNA, nurse midwife, and so on. Okay, so that wraps up this video on how to become an LPN. If you'd like to watch more nursing videos, you can access the link in the YouTube description below.